I got a question recently asking whether menopause can cause ringing in the ear, what's known as tinnitus. Yes, it can. In fact, tinnitus or ringing in the ear is one of the very common but less spoken about symptoms of menopause. And ringing in the ear can happen in one or both ears. It can also come and go. For some people, it stays and it's very severe. And sometimes it's a buzzing sound. It can be a high-pitched buzzing sound. Other times it actually even sounds like it's your heartbeat. It's always coming from the inside. And the reason it happens in menopause is mostly due to estrogen decline. We have estrogen receptors everywhere in the body, including the inner ear. And the inner ear and the brain are very sensitive to blood flow changes or nerve activity changes. And when estrogen declines, the blood flow in the inner ear and in the brain is reduced. Also, estrogen supports a fluid balance in the inner ear, and that's why some people will have tinnitus and also have dizziness because they are losing balance. They feel like the room is spinning, or they have some dizziness, or they have some balance issues. Also, estrogen supports blood vessels before menopause. So, as estrogen is declining, the blood vessels change, therefore, the blood flow changes, and this could also increase blood pressure. Blood pressure also affects the inner ear. Another thing that happens in menopause is bone loss. When bone loss occurs, the jaw is affected. Some ringing of the ear is coming from jaw misalignment because you're losing bone in the jaw. So, other things that can affect it is inflammation, lack of sleep, anxiety, depression. So when it comes to addressing tinnitus or ringing in the ear, it has to be from multiple angles. Maybe you have to check with your dentist to see if they can see if there's jaw misalignment. You might have to get prescription medication, especially where it's coming through just one ear and it's feeling like a heartbeat. That needs to be checked urgently. Another thing that helps is menopause hormone therapy. Also, cognitive behavioral therapy has been used, and then you can also take magnesium. Magnesium glycinate helps with the blood flow to the brain and also to the inner ear. Exercise also helps to improve blood flow, and then take care of sleep, reduce stress, and if you need medication for things like anxiety or depression, that needs to be addressed too. Share this with someone else who is in menopause. Let me know if you have any questions, and take care.